Okay, in this video we're working on hip internal rotation. So when you are set up in the 90-90 position, the back leg is in an internal rotation. So if you have limitation here, whether it's tightness or you have pinching in the hip, so what you do first is you assess how much internal rotation you have in this position. So you'll use your hand, relax your leg, and see how far you can lift up your back leg. So this is the motion that you have available to you at this time. So the difference here in how we actually retain the range of motion that we should gain, we want to strengthen in this range. So the interesting part is this is me passively. Again, I'm using my arm to get in this position. But when I try to actively do it, I only get a couple inches off the ground. So we're going to work on that and just wherever you are. So let's say you can only lift to here. For me, you can use something underneath you. I think the foam roller thickness is a little too advanced for me at this time. So I'm going to use a yoga block and I'm going to place my foot on top of that. Make sure the knee stays down on the ground. So once I'm in the position, what I'm going to do is I'm going to push down actively into the block for about 3 seconds. After 3 seconds is up, then I'm going to try to lift my foot and I'm going to hold it for 10 seconds here. You'll feel this deep muscle activating here, your internal rotators. So once 10 seconds is up, you relax your foot back down, you repeat the same thing 3 times. So again, pushing down 2 to 3 seconds, about 50% effort, and then you're going to lift. It's okay to lift or lean your body forward, and then you're going to lift for 10 seconds. If you are not able to lift up off the floor at all, it's okay to just start on the floor. So same concept, 3-second pushing down into the ground with your ankle, and then you try to lift up as far as you can for 10 seconds. You should feel those muscles activate. So let's just say, again, you don't necessarily clear the floor, but you should still feel these muscles firing. It might be really frustrating because you can't visually see your foot lifting, but we got to start somewhere. So basically, usually when this happens, maybe it could be weakness, maybe it could be capsule tightness in the hip. So what you can do also in this position, you can use your hand, you put it right here in your knee crease, and you're going to push down. So you're tractioning the hip joint here, you're pushing down, and then you're going to kind of lean your pelvis back. So this is going to put the back of the hip capsule on stretch. Again, keep the pressure pushing down with your hand to assist in the stretch. And you're going to just hold this position literally for 2 seconds. You're stretching out the hip area. And just go ahead and set a timer. So anyway, again, passively assess how much range you have, and then acclimate whether you're starting on the floor or somewhere a little bit higher by seeing how much range you have actively. Pushing down 3 seconds, lifting for 10 seconds. Over time, this should get easier. Maybe you won't get as high, but it'll get easier. And then over time, depending on your anatomy and how much range of motion you have in the hip joint, will depend on how you progress over time. And then to actually help with range of motion itself, so let's say you're super limited in passively even just moving your leg, we can do that traction. So again, pushing down in the knee joint, or near the knee crease, not the knee joint, the knee crease, then rocking your pelvis back, and then holding this stretch for about 2 minutes.